Hi, welcome back. This is Jen, your Medicare and retirement guide, and today we're continuing our ongoing series with My Parent is Aging and I Have No Idea What to Do. So we're going to ask the internet's most asked questions in terms of their Medicare coverage and what you need to do to go ahead and take care of your parent and make sure that they're up to date on everything involving their healthcare coverage. So today's topic is going to be managing medical needs. And remember, as always, if you like this information, if you find it really useful, like, subscribe, comment down below on what you would like for me to cover next, and I'll be more than happy to answer any of your questions. So, first question of the day. What do I do if my parent is suddenly hospitalized? Will Medicare cover it? Answer, yes. Because if they have their Medicare Part A, that covers inpatient, everything that has to do with the hospital, and you have to make sure that the hospital considers them admitted, not under observation, admitted into the hospital. If they're considered under observation when they're in the emergency department, that is not in hospital stay, that's an emergency department visit. That is a completely separate cost and a completely different category than actually being admitted into the hospital. So the coverage rules do change when they place the justification in the little box if your parent is under observation or if they're admitted into the hospital. If they do not have their Part A coverage, remember, Part A is for free as long as your parent has worked for 10 years or 40 quarters and they get their Part A for free. If they just so happen to have Medi-Cal or Medicaid, that will step in and pay for their hospital stay. If they do not have coverage at all, that is where I'm going to be sweating some bullets right now, okay? So they better have coverage in order to go into the hospital. There are different programs to go ahead and help subsidize for that. That is something that you have to ask the social workers at the hospital in the event that they do not have coverage, period. So that's a completely different scenario. In this instance, I'm working with the information that they do have Medicaid, they do have their Part A. Hopefully, last case scenario, if they do not have coverage, make sure you ask the social workers of the hospital what kind of programs your parent can qualify for to go and help pay for those hospital services. Next question here, how do I make sure there's no gap in coverage if they switch plans? So plan changes should be considered during a valid enrollment period. So we've talked about here before, annual enrollment period, open enrollment period, or special enrollment period. So if you do not fall under the annual enrollment period option, which would be from October 15th to December 7th, or open enrollment period, which is January 1st to March 31st, if you're in that 6-month limbo period, make sure you're working with somebody who knows how to go ahead and justify and put in the application, like a trusted agent, to go ahead and make sure they are explained, this is what's going to happen, this is what your responsibilities are going to be because we're switching your plan mid-year, these are your patient rights that you should know, and if you're taking, certain prescription drugs, you are, now switching medical groups, are your doctors going to take your new plan or not going to take your new plan? Make sure that you are aware of the rules of the game so that you're not caught off guard. Next question, are there specialists in network with this Medicare plan? So if you have a Medicare Advantage plan and you are switching or entering one, make sure you clarify what doctors you would like to be a part of your plan and what are the benefits that you will be receiving, while keeping the same doctors, or if the benefits outweigh the need of that particular doctor. That is something that you will have to decide for yourself. With that said, your parent is entitled to a 12-month continuum of care. So what does that mean? It means that if your parent just had a surgery and they need to follow up with that particular doctor from their surgery, they are entitled to a 12-month continuum of care plan coverage. So even if they switch medical groups and that doctor is not part of that new medical group, they're outside of network, that medical group needs to follow a 12-month period for your parent to continuously see that particular doctor who has done that particular service or surgery for them. It is part of their continuum of care. Next question. How do I find out if they qualify for programs like Extra Help or Medicaid? Fabulous question, and one that I wish more clients would ask me, because a lot of them don't realize that they do qualify for these additional services like the Extra Help tool that is on ssa.gov to see if they qualify for something that's called low income subsidy, which will help pay for their medication. In addition to that, they should look up their state's socialized programs like, like the food stamp program, the assistant additional, monetary needs programs, their health programs, actual Medicaid itself. Your parent may qualify for a lot more services than they realize, but they've never had someone go ahead and evaluate that. And there's different, departments. It is a little bit of a daunting task, but in the long run, getting that extra help is going to reduce the stress of your parent on your finances, on your family. And to me, that stress is going to, in the long term, reduce a lot of those potential chronic illnesses that would develop because of that stress. So, let's think, compound interest here. If we put in the work now to go ahead and find all these different monetary ways to reduce your parent's stress, that is going to compound to a better quality of life of that parent. So it's a little bit of extra work, but it will pay off in the long term for yourself and for your parent. Last question we have here. Can Medicare coordinate with their VA or retiree benefits? Yes. So remember, the VA, Veteran Affairs, is separate. However, the VA does have certain benefits and certain insurance plans that they can qualify for, but you need to make sure that you have all the information, especially if you have a veteran parent, to get those benefits situated and make sure that they still keep their VA benefits and see what additional benefits they can qualify for while utilizing both for that parent. I'm thinking about doing a VA series next. Comment down below if you're interested in seeing a VA series next and how to manage a parent who has those VA benefits. Retiree coverage. Okay, so if your parent isn't with the VA, they're, regular civilian over here. So Medicare is gonna act as the primary account. Unless they have like a private insurance plan with a company that they're still working with, or if they have Medicaid, it's gonna depend if they have, additional insurance plans like that. If your parent just has Medicaid, then Medicare is going to take over as the primary. So you need to make sure, okay, if my parent's still working, the employer coverage may act as the primary with Medicare being the secondary. Just make sure that when you go to the doctor's offices or if they end up in the hospital that they understand like, hey, we have two coverage plans, mainly just for billing department purposes. Billing department usually has to figure out who they're going to send the bill to first. So if they're going to figure out if they're going to go ahead and send it to the employer coverage or to Medicare, or if they just have Medicare and Medicaid, they're going to automatically know we're going to send the bill to Medicare first, and then we're going to send the secondary bill to Medicaid, et cetera, et cetera. So other than that, those are actually all the most searched questions in managing the medical needs of a parent using their Medicare insurance. If you like this type of video, please consider sharing, liking, subscribing. Again, comment down below of what kind of videos you would like to see in the future. And when you're ready, my link to contact me to review your benefits is in the description down below, and I will be more than happy to go ahead and review your benefits for you. In addition to that, keep watching. I have a ton of videos to watch here if you want to go down this deep dive rabbit hole, and if you want to continue watching the rest of this series, go ahead and wait for the next video. Other than that, I'm Jennifer, your Medicare and retirement guide, and I'll see you in the next one. Bye-bye.